What is epilepsy? Define it for me.
Epilepsy is a neurologic disorder that actually consists of a predisposition to persistent epileptic seizures.
Okay.
And basically that means that a patient has an electrical predisposition to having seizures or clinical symptoms that are caused by aberrant electrical activity in the brain.
We have a 3D model that I'd like to share with our viewers that I believe shows the brain and a seizure occurring. So why don't you walk us through this and let us know what's going on?
So what's happening here, and while it's a basic model, there's an area of the brain that appears to have a increase in brain activity, and that quickly spreads to the rest of the brain, causing a seizure.
And that little, you see that little thing that's coming out in the center? I see all the blue around, but all of a sudden there's a little flash. What is that, doctor?
So that flash is the area or the focus that causes the seizure, and that's usually because of, again, some sort of electrical predisposition to firing, causing a synchronization of neuron firing within the brain, and thus what we see as a seizure.
And is this genetic, doctor? Is this just something that happens?
There are various causes for epilepsy. There are genetic causes as well as environmental or incurred causes such as trauma, strokes, neurodegenerative processes as well.
The different types of seizures, some that you may experience or maybe someone that you know. Let's go through this, doctor, and excuse me. Focal onset, let's talk about that first.
That means that the seizure originates in one part of the brain, and depending on which part of the brain that is, you will see a complex symptomatology or signs of that seizure. A complex focal seizure is a seizure that starts in a certain part of the brain and spreads locally and causes a dyscognitive state, so the patient becomes unaware. And the main difference between a simple focal seizure and a complex focal seizure is just that a simple partial seizure, usually you do not lose consciousness, you're certainly aware of your surroundings, and complex partial seizure usually causes some sort of dyscognitive or altered mental status state. One would have more impact than the other on day-to-day life, including, having to pay attention to certain tasks at work or in school or driving or so on and so forth.
Okay, so let's move on to generalized onset and then what's underneath. Define that for us,
So generalized onset seizures cause different forms of seizures, including absence seizures, which are classic staring episodes that we're accustomed to seeing, and atonic seizures are basically when the body becomes limp and if people fall, they can incur certain traumas to the head, and that's a major repercussion from atonic seizures. Of course. Generalized tonic-clonic seizures are seizures that most people, when they think of seizures, and those of you listening at home, probably have witnessed one in your lifetime. They're very dramatic and very scary to observe. And these involve generalized tonic or ballistic limb movements, and you can't miss it, basically. A myoclonic seizure is a form of generalized seizure that causes basically myoclonus, which is a erratic generalized limb movement.
We have a list of the different signs, and you and I were talking about it before the show started, the signs and symptoms to look out for, which is so important because sometimes it's really important to get that help immediately when you see some of these signs. Let's walk through these, doctor. I'll take the first one, periods of rapid eye blinking and staring. We've seen that. I've seen that sometimes in family members in my lifetime. Mm-hmm.
So I'm sure all of you listening at home can look at this list and start to think about people or family members that they've seen having symptoms like this, and not all these symptoms for sure indicate that someone has seizures. However, they could be signs and symptoms of seizure disorder. So periodic rapid eye blinking and staring is something that we do see with complex partial seizures or generalized seizure disorders. Jerking movements of the body, that's what we kind of talked about before with generalized tonic-clonic seizures and myoclonic seizures. Stiffening of the body, that's describing a generalized tonic-clonic seizure, where all the muscles and all the extensor muscles in the body all activate at the same time. Loss of consciousness. So there's various causes of loss of consciousness, seizure being one of them, and it's very important to take a detailed history and to understand what may have caused a loss of consciousness episode, possibly seizure, breathing problems, hyperventilating, and so on. Loss of bowel and bladder function. Very frequently, we observe loss of urine or bowel control with a seizure, so it's part of our history and something we see commonly. So it's helpful in ascertaining whether this was a seizure or not. Falling suddenly, so we talked about atonic seizures, and nodding of the head rhythmically even could also represent a seizure.
There are different ways of diagnosing seizures. Let's show our viewers what those are, doctor. Would you do all of those?
Really, for the diagnosis of a seizure disorder, the definitive diagnosis lies in an electroencephalogram. Even with an electroencephalogram, with video to capture an episode and to provide the patient and provide the medical practitioners involved with an electroclinical correlation that this is a behavior or a abnormal thing that we observed, and this is the aberrant electrical activity in the brain, and that there lies the definitive diagnosis. The other tests mentioned, the neurological exam, the blood test, the imaging test, and the spinal tap, these are adjunctive tests to support your diagnosis, and in many cases a neurological exam could indicate cognitive impairment, poor attention. Even after you've had a seizure, you can have residual weakness in the arm affected, which is called Todd's paralysis, sometimes looking like a stroke. Blood tests in the acute setting, you can have an acidosis or a prolactin elevation or certain types of blood tests that help us along the way.
What's a prolactin elevation? I'm sorry?
Is a certain hormone that our brain produces that can sometimes be elevated after a seizure. Not again, just an adjunctive kind of test. Imaging tests, we have MRI, which could indicate a lesion in the brain, a tumor, a stroke that could be causing the seizure. There's also more sophisticated imaging tests in that we measure the activity in the brain, in certain parts of the brain, using SPECT analysis, where we can look at the metabolism within certain parts of the brain and extrapolate and say, oh, well, that part of the brain is not metabolizing well and may have a seizure focus there. So spinal tap was mentioned. It is a good idea to perform a spinal tap in a new onset seizure that comes out of nowhere. We don't know what caused it. We want to rule out an infection because that is a treatable cause of epilepsy.
When should you go see a doctor? Because there's a lot of people that may not know what's going on. We have a graphic that may help you understand when it is time to, get in the car and go see that doctor. Number one, a seizure. That makes it obvious. If you see a seizure, maybe it is time.
Yes, and again, what we learned in the first portion was that seizures can be anything from a generalized tonic-clonic seizure to abnormal behaviors, loss of consciousness, even head nodding. So if you witness any of these things in your family member and you think that this may be a seizure, it's very important to visit a doctor and seek out a diagnosis so that you can effectively be treated and as soon as possible. Unexplained loss of consciousness, if you or your family member experiences that, it's a very good idea to see a doctor and even a neurologist to do a full workup for both neurologic and cardiovascular causes. Unexplained shaking or rigidity indicating a seizure or a seizure-like episode should be evaluated. Unexplained memory loss or cognitive decline something that we see in practice very often, and I get this question a lot, is staring episodes in the young. My son is in school, and the teacher's saying, hey, he's staring off into space, and sometimes I can't get through to him for a few seconds. Abnormal sleep behavior, while that's very common symptom, it can also indicate certain types of seizures, particularly frontal lobe seizures. Waking up with evidence of unexplained blood on your pillow, unexplained muscle soreness, feeling very groggy for no reason whatsoever, and episodes of decreased responsiveness, which are recurrent and stereotypic, could also indicate seizures.
And we had 8 bullet points there. Do you wait for all of them, or a couple of them, or if you see one of them?
I think that if you see one of them, it is a good time to intervene and be evaluated by a specialist.